So one thing that can distinguish someone who went to medical school from those who did not is actually the terminology and the language that they use. Let's say, for example, if you're communicating with other medical professionals, you need to make sure that you're well oriented and you really understand the language that they speak. Let's say, for example, if you want to refer a patient to a specialist, you need to make sure that you examine the patient and then you are able to describe the position, let's say, for example, of a tumor that they have. You need to make sure that you described the exact position using medical language. So today we want to introduce you to anatomic language in terms of the position and direction. The first position that we need to learn about is the anatomic position, and this one is the position in which the patient is standing erect with the upper limbs by the sides and their palms facing forwards and their feet facing forward. I'm going to draw a plane that passes through the midline, dividing the body into two halves, which is the left and the right. And this plane, we call it the median sagittal plane. Such that when something is closer to the median sagittal plane, it is medial. And if something is far away from the median sagittal plane, it is lateral. For example, in this case, this is the medial border of the upper limb, and this is the lateral border of the upper limb. And let's say we want to describe the position of the areola relative to the upper limb. We say that the areola is medial to the upper limb, and the upper limb is lateral to the areola. Another plane that we need to talk about is the coronal plane. So the coronal plane divides the body into two parts. This time it's the back part and the front side. The front part, we call it the anterior, and then the back part, we call it the posterior. So that when I'm describing the positions, let's say for example of the eye relative to the ear, we say that the eye is anterior to the ear and the ear is posterior to the eye. If we are describing the positions in of the hand, we have got two surfaces. The anterior part is called the palmar surface, and then the back part is called the dorsal surface. Another plane that we need to talk about again is the transverse plane. This one cuts the body into two parts, the upper part and the lower part. If something is towards the upper part, it's superior. If something is on the lower part, it's inferior. For example, we can say the breasts are superior to the waist and the feet are inferior to the waist. On the same transverse plane, I need to introduce you to two terms which are proximal and distal. And we usually use these terms when we are studying the limbs, which is the upper limb and the lower limb. So if something is closer to the transverse plane, it's proximal. And if it's far away from the transverse plane, it's distal. For example, I can say that the hand is distal to the shoulder and the shoulder is proximal to the hand. If the patient is lying in this position facing upwards like this, it's called the supine position. And if they are like this, it's called the prone position. Let's move on to the next two terms, which are superficial and deep. And I want you to take note of the fact that superficial means towards the surface and deep means towards the inner part. So the most superficial organ in the body is the skin, and one of the most deep organs is, for example, the heart. When two structures are on the same side of the median sagittal plane, for example, the right arm and the right lower limb, we say they are ipsilateral to each other. If they are on the opposite sides, we say they are contralateral to each other. If they are found on both sides, let's say right and left, we say they are bilateral. If it's on one side, we say it's unilateral. So we've come to the end of the topic, and these are almost all of the planes that you need to know and the positions that you need to know if you want to study anatomy in medical school. If by any chance you find this video helpful, please consider subscribing to our channel and click the notification button so that you can be notified when we upload a new video. Please don't forget to like the video or share it with your colleagues. Enjoy your learning, and goodbye for now.